Most people never think about the size of their kidneys, and that's exactly the problem. I'm Dr. Eleanor Hayes, an internal medicine physician, and in over 20 years of clinical practice, I've seen something that genuinely concerns me. Patients come in for routine imaging, an ultrasound for something completely unrelated, and the radiologist notes, almost as a side comment, that the kidneys appear smaller than expected for age. Not dramatically, not catastrophically, just quietly, measurably smaller than they should be. And when I ask the patient about their daily habits, the same patterns come up again and again. Here's what most people don't know. Healthy kidneys are roughly the size of a fist, and while some degree of kidney shrinkage occurs naturally with age, largely due to a gradual loss of functional filtering units called nephrons, research shows that certain everyday habits significantly accelerate that process. They don't cause dramatic sudden damage, they cause slow, cumulative, invisible damage that builds over years. That's the concept I want you to hold on to throughout this video. I call it the slow drain. Your kidneys don't fail overnight, they drain slowly, quietly, one nephron at a time. The habits I'm going to describe today each contribute to that drain in a distinct way, and the earlier you recognize them, the more you can do to slow or stop the process. Let's go through them. Habit 1. Taking over-the-counter pain relievers daily or near daily for chronic pain. This is the habit I encounter most often, and it's the one that causes the most uncomfortable conversation in my office because the people doing it aren't being careless, they're in pain, and the medication works. Here's the science behind why it matters. A class of medications called NSAIDs, non-steroidal anti-inflammatory drugs, includes common over-the-counter options like ibuprofen and naproxen. These medications work by blocking certain chemical signals in the body that cause pain and inflammation. But those same chemical signals also play an important role in regulating blood flow to the kidneys. When you take an NSAID occasionally for a headache or a sore muscle, the kidneys handle this without significant consequence. The problem is daily or near daily use, particularly in adults over 60. Research shows that regular NSAID use constricts the blood vessels supplying the kidneys, reducing the blood flow they depend on to function. Over months and years, this reduced blood flow contributes to a measurable loss of kidney tissue, a direct contribution to the slow drain. Studies published in major nephrology journals have consistently shown that chronic NSAID use in older adults is one of the most significant modifiable risk factors for accelerated kidney function decline. The word modifiable is important there. It means it's something that can be changed. The real-life pattern looks like this. Someone in their early 60s develops knee arthritis. They start taking ibuprofen daily because it works and it's easy to buy. 5 years later, a routine blood test shows their kidney function has declined more than expected. Nobody connected the two. Nobody asked about the ibuprofen. I'm not suggesting that pain should go unmanaged. Pain management is a legitimate medical need, and there are real alternatives: topical anti-inflammatory creams, acetaminophen in appropriate doses, physical therapy, and prescription options in some cases that place far less burden on the kidneys. This is a conversation worth having with your doctor if daily pain relievers are part of your routine. Habit 2. Chronically underhydrating and not realizing it. Stay with me here because this one is more specific than it sounds and more important than most people appreciate. We touched on hydration in a previous video in the context of sleep, but what I want to talk about today is a different and more serious pattern. Not occasional dehydration on a hot day, chronic, low-grade underhydration, day after day, year after year, in someone who genuinely doesn't realize it's happening. Here's why this is so common after 60. The thirst mechanism, the signal your brain sends when your body needs water, becomes measurably less sensitive with age. Research consistently shows that older adults can be significantly dehydrated before they feel thirsty at all. This means the internal alarm that worked reliably at 30 is no longer a dependable guide at 65. Here's what's happening inside the kidneys when fluid intake is consistently low. The kidneys must work harder to concentrate urine and preserve water for the rest of the body. That concentrated urine contains higher levels of minerals and waste products, including calcium oxalate and uric acid, that can slowly damage the delicate tubular structures inside the kidney over time. Chronic underhydration is also one of the leading contributors to kidney stone formation, and repeated kidney stones cause their own form of cumulative kidney tissue damage. Beyond stones, Research suggests that habitual low fluid intake is associated with faster decline in the glomerular filtration rate, which is the key measure of how well the kidneys are actually filtering. Every point of decline in that number represents real, functional kidney tissue that isn't coming back. The slow drain connection here is direct. A poorly hydrated kidney is a more stressed kidney, and a chronically stressed kidney over years loses functional mass measurably faster than one that is consistently, adequately hydrated. The practical implication is this: don't wait for thirst. Build consistent hydration into your daily routine as a deliberate habit, rather than a response to a signal that may no longer be reliable. For most adults over 60, light yellow urine throughout the day is a more useful guide than thirst alone. Dark yellow urine, particularly in the morning and persisting into the afternoon, is a signal worth paying attention to. Habit 3. Eating a high-sodium, high-protein diet for years without realizing the kidney-specific effects. This is the one that surprises patients the most, because both sodium and protein are parts of a normal, everyday diet. Nobody thinks of breakfast or dinner as something that could be slowly shrinking their kidneys. Let me explain the two parts of this separately, because the mechanisms are different. Sodium first. The kidneys are the primary organ responsible for regulating sodium balance in the body. When sodium intake is consistently high, the kidneys have to work harder to filter and excrete it. Over time, this sustained workload contributes to elevated pressure within the kidney's filtering units, the glomeruli. Research shows that chronically elevated intraglomerular pressure, the pressure inside those tiny filtering structures, causes progressive damage to them. It's the same basic mechanism by which high blood pressure damages the kidneys from the outside, except this is happening from within the filtering units themselves. Studies suggest that high-sodium diets in older adults are independently associated with accelerated loss of kidney function, even after accounting for the blood pressure effects. The two problems compound each other. High sodium raises blood pressure, and high blood pressure further strains the kidneys, which are already under pressure from the sodium load itself. Now protein. This one is more nuanced, and I want to be careful here because protein is essential, and adequate protein intake in older adults is genuinely important for muscle preservation and overall health. The issue is not protein itself. The issue is consistently very high protein intake, particularly from animal sources, in someone whose kidneys are already showing signs of reduced function. Here's why. When the body metabolizes protein, it produces nitrogen-containing waste products, primarily urea, that must be filtered by the kidneys. A higher protein intake means more urea production, which means more filtration work for the kidneys. In people with fully healthy kidneys, this extra workload is manageable. But research suggests that in adults over 60, particularly those with even mild, undetected kidney function decline, consistently very high protein intake may accelerate the rate of nephron loss over time. This does not mean cutting protein dramatically. It means being thoughtful about source and quantity, and particularly about how plant-based protein sources may place less demand on the kidneys than very high animal protein intake. It's also one more reason why periodic kidney function monitoring matters after 60, because the appropriate dietary protein level genuinely depends on where your kidneys are currently functioning. The slow drain connection for both sodium and protein is the same principle. Chronic overload of the kidney's filtration and excretion systems, sustained over years, contributes to faster loss of the functional kidney tissue that cannot regenerate once it's gone. Here is the surprising insight I saved for last. One of the most underappreciated facts about kidney health after 60 is that kidney damage is largely silent until it's significant. The kidneys have such substantial reserve capacity that most people feel completely normal even when their function has declined by 30, 40, sometimes close to 50%. This is not a reason for comfort. It's a reason for proactive testing. A simple blood test called the eGFR, estimated glomerular filtration rate, and a urine test checking for albumin can tell your doctor an enormous amount about where your kidneys are and which direction they're trending. These tests are inexpensive, widely available, and vastly underused in routine senior care. If you haven't had these checked in the last year, that's a conversation worth starting at your very next appointment. Here are 3 smart questions to bring to your doctor. Can we check my eGFR and urine albumin at my next appointment to get a baseline for my kidney health? Given my pain management routine, are there kidney-friendlier alternatives I should consider? Is my current protein and sodium intake appropriate for where my kidney function currently stands? Let me leave you with this. Your kidneys have been working without complaint for your entire life. The slow drain doesn't have to be inevitable. 3 habits: daily use of NSAID pain relievers, chronic underhydration, and years of high sodium and very high animal protein intake are among the most significant and most modifiable contributors to accelerated kidney aging after 60. You now know what they are, you now know why they matter, and you have the right questions to start an informed conversation with your doctor. Now I want to hear from you. Which of these 3 habits hit closest to home for you? Leave your question in the comments below. Each week I bring your real questions to specialist doctors, and yours could be featured in an upcoming video. Tell me what topic you want next. This channel is built around what you need to know. If this video helped you, please subscribe. Every week I share research-backed health insights you won't find in a 10-minute doctor's visit. This video is for educational purposes only and does not replace advice from your personal physician.